If you can't get rid of a double chin and your weight is in a healthy range, then you're likely not addressing the postural causes that can contribute to this problem. I'm going to show you the 3 factors that might be causing your double chin, and I'll give you an exercise sequence that addresses each one. The first area is an obvious one, your neck. With the double chin, there is upper cervical or cranial flexion. This affects the rest of the neck or cervical spine. When the head flexes down, the neck straightens when normally it should be curved. The fix then is to reverse engineer this process. Lie on your back with your feet flat. Place a rolled up towel under the neck. This towel helps restore the normal curve that should be in your neck. Make sure to keep your waistband flat on the ground without forcing. This addresses an important postural piece that can affect the double chin that I'll talk about later. If you can't get it, raise your feet on a box. Move your chin slightly away from your neck. Think about untucking it. With a double chin, muscles on the front of the neck get tight. When you untuck the chin, this places those muscles on stretch, helping them relax. Take a slow 5 to 10 count inhale through the nose. This makes sure that you can breathe without overusing your neck, another factor that can contribute to having a double chin. Now do a slow 4 to 10 count exhale through the mouth, reaching your arms slowly towards the ceiling as you do so. Keep the reach only about mid-range. If you notice your head tips back or you end up double chinning, you've gone too far, kid. Take 5 to 10 slow breaths in this position, letting your back gently flatten into the ground, which is actually the sneaky reason that almost everyone glosses over when it comes to addressing a double chin. I mean, why is your neck and head even in that position in the first place? And that's often because those with the double chin have a deep arch in their lower back. When your lower back is arched, your body's falling backwards. So it's not uncommon for the head to flex down to keep you upright. So if you don't account for this, your results aren't going to last long, but this move will help you with that and then some. Lie on your side with the bottom leg straight and your top hip bent, resting on a foam roller or box. Your chest should be parallel to the wall. Rest your head on some pillows and hold a weight with the top hand. Keep your eyes on the weight. Make sure to untuck the chin here so you reduce that double chin. The bottom hand should gently press into the ground. Simply hold this position and breathe. Slow 5 to 10 count nasal inhale, slow 4 to 8 count exhale through the mouth. You want to kick this up a notch, reach the weight toward the ceiling. Just make sure when you do that your chin stays away from your neck. To up the difficulty, you can rotate your body in this position. As you inhale, slowly roll to your back, swinging the top leg to the ground. On the exhale, press the weight to the ceiling and roll back into the start position. Make sure that as you roll backward, your chin doesn't fall back into that tucked position. Keeping your head on a pad usually helps with that. Now, it's pretty common that even when the spine position is accounted for, some people can present with a double chin. And that's because one key area in your face region is hanging too low. Quick, where is your tongue in your mouth right this second? If it's not plastered to the roof of the mouth and it sits low in the throat, your tongue can actually be a reason why you have a double chin. Because when the tongue sits low in the throat, it causes the floor of the mouth to droop down. This can also pull the neck down, contributing to the double chin presentation. So to fix this, not only do you have to be able to get the tongue up against the roof of the mouth, but it has to fit in between the teeth. So you need to make sure that you have adequate mobility. You need to have the control to get it up in between the teeth and then be able to sustain this tongue position over the course of the day. But don't worry, I'll show you how to do all 3 of those things with a few simple moves. The first one involves sticking your tongue on this rough patch that's right behind the front teeth. It's called the rugae. Once your tongue's on the rugae, glide the tongue back along the roof of the mouth and forward. It's normal to feel a stretch on the base of the tongue as you do this. What it's doing is it's freeing up some of the fascia that attaches to the bottom of the tongue, which can allow you to get that whole sucker up to the roof of the mouth. From here, you have to learn now how to make the sides of the tongue thinner. This is what allows the tongue to fit between the teeth, and all you need is a chopstick. Take a chopstick and place it underneath your tongue and lift it up. From here, bring your tongue to a point. If you feel the sides of your tongue working, you got it. Keep this tongue position for a 30 to 60 second hold. Now you have the components needed to get the tongue up to the roof of the mouth, but you have to make sure you create an adequate suction on the palate so it pulls that skin back up. First, place the tip of the tongue on the rugae. Then, place the middle and back of the tongue up against the roof. Swallow a couple of times to create an adequate seal. If you struggle getting the tongue up to the roof, you can make a clucking noise a few times to encourage the back of the tongue to kick in. Once you've nailed the position, close your lips easily and quietly nasal breathe over the course of the day. Now, it's not uncommon once you've freed up the double chin to have it deviate to one side or the other. If that's you, then I would check out this video right here because it has some effective moves to help fix that in a jiff.